All right, the last bit with viruses that we're going to discuss is the link between viruses and cancer. All right, may not be a real clear link initially, but studies over time have shown that certain viruses do result in the formation of cancer and tumors. All right. One of those viruses that we're going to talk about is going to be the HPV virus, or the human papillomavirus. All right. That human papillomavirus is going to be a DNA virus. And this is another example of a virus that has the ability to integrate into the host's genome, all right, or the host cell. So in terms of that, the HPV virus is another one that can lay dormant for years and years, all right? And this can be one virus that comes up in terms of women, because now when you go to get your pap smear, they test you for HPVs also, all right? And you may be negative, 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 and you've been married to your husband for 5 years now, and then all of a sudden you come up positive for HPV, all right? Doesn't mean necessarily that the woman was cheating. The virus can lay dormant for a decade easy, okay? So in terms of that, the HPV virus is another one that has that enzyme integrase, all right? It's going to be a different integrase than what we saw and talked about with the HIV virus. Because if you remember, the HIV virus was an RNA virus. This is a DNA virus. So in terms of that, the HPV virus can also lay dormant for an extended period of time, all right? And in terms of HPV, there are going to be a couple types that I want you to know, all right? There are more than these 4 types that I'm going to kind of outline here. But for this class, these are the 4 I want you to know. These are going to be the 4 that are probably going to be most clinically relevant to you. All right? We've got HPV type 6 and 11. Okay? This is what's associated with venereal warts, okay, or genital warts. And in terms of that, this is these two, the 6 and 11, are classified kind of as a low-risk HPV. Because if you have an infection with HPV 6 or 11, typically those warts don't progress onto cancer, all right? They're not pleasant. There are ways to deal with it. There can be use of cryo therapy to burn the warts off. You can surgically get rid of the warts. But typically, these are not going to progress to cancer, all right? I'm going to put this in yellow because I don't have red, okay? HPV type 16 and 18. These are your high-risk HPVs, okay? These are the HPVs that are associated with cancer. All right, and in terms of that, we're talking cervical cancer in the case of women. And guys, I don't want you to feel left out. Don't think HPV can't give you cancer too, because it can. The cancer associated with HPV in men is going to be penile cancer, okay? So in terms of that, gentlemen, you want to make sure that you don't end up with HPV 16 and 18, because what ends up happening is the cancer is associated with the penis, all right? And when we're talking about cancer, best way to treat cancer is going to be removal of that tissue. So if I haven't scared you now into using condoms, okay, hopefully that'll do it, okay? Because in terms of that, HPV 16 and 18, it's not just associated with women, all right? Although initially the vaccine that is associated with HPV. Gardasil. Oh, I think I spelled that right. Wrong. I think that's an A. Gardasil, yeah, okay. Was initially targeted to women. But in terms of that, the female population is only half of the sexual population, all right? Now, it is also recommended for men to get that vaccination as well, all right? Typically, the age of vaccination is in the range of 13 to 26 years. One of the key factors associated with this particular vaccine is it has to be given before any sexual experience. Because the way vaccinations work, if you are already infected with the virus, vaccines are not going to do anything to stop the viral progression, all right? The way vaccines work is to prime your immune system so that your immune system targets that particular virus before it can take hold. And the only way that's going to happen with HPV is if the vaccine is administered before the person has sex. So in terms of that, that's why it starts out at what some feel is a relatively young age. I think initially they were targeting, at least when it came out for women, they were targeting women in the age range of 11 and 12 as well. But people objected to that. But the reality is, it's only effective if it's given before sexual experience, okay? And that's why the early age associated with that, okay? But the benefit here with Gardasil is it's not only protecting against HPV 16 and 18, it prevents the other two, the low-risk form of HPV as well. So it targets HPV 6 and 11. This is another part of the objection to the Gardasil vaccine is venereal warts are associated with sexually transmitted diseases. And people objected to a 13-year-old being given something for a sexually transmitted disease. But in terms of overall health, all right, it's better to prevent that from ever happening, okay? So that Gardasil, when it was initially came out, targeted 6, 11, 16, and 18. I believe they have separated things out now that you can just go for the cancer portion of it. Really beneficial to be inoculated or protected from both types, both the low and the high risk, okay? The HPV 16 and 18, this is going to be the one that's associated with cancer. Essentially what ends up happening, that virus causes changes in gene regulation. All right, so we're mucking with, again, transcription and translation. And that's what allows the uncontrolled growth. That occurs with HPV, okay? So I pick on HPV because HPV is one of the more common sexually transmitted diseases in the population. And in terms of HPV, I know I just picked 4 here for you. There are more than 150 different types of HPV out there, okay? So it's a really common virus. All right. If you have any questions,